Hi, I'm Dr. Binyo. My specialty is combining with Western and Eastern medicine to reverse chronic disease. I was invited to the United States in year 2000 to train physicians and graduate students in integrating acupuncture, herbal medicine into conventional medicine practice. I was teaching at MD Anderson, Methodist Hospital, Memorial Hermann Hospital, Rice University on integrated medicine. So I've been practicing clinical medicine in the clinic. We have practiced in Houston over 15 years. Now, what I would like to talk about today is about how to cure migraine. Yes, I talked about that last week. I received a lot of questions and inquiries. I would like to talk about one more time today how to cure migraine. To cure migraine, number one, you need to identify the cause, because some of the migraine are not curable, like if it's caused by tumor, trigeminal neuralgia. So you have to work with your physician. It's critical to understand that. Cure means relief, recovery from a disease. As long as you have 6 months without symptoms for migraine, clinically we call you cured. So let's talk about the migraine. To cure migraine, number one thing, you need to identify the cause of the problems. That when a person having migraine, it's terrible symptom. Like what? Like headache on one side or both sides, together with flashing lights, aura, or nausea, vomiting, dizziness. Why they have all those symptoms? They're actually affecting how many people in the United States? 15% of the women, 6% men. And this is the number 6 causes of disability. So it's a very bad disease affecting our life. It's terrible. What we need to do is that we really need to help our patients to identify the cause of the problems. I'll explain to you step by step why you have those symptoms, why you have nausea, vomiting. Now, with the technology we have now, based on functional MRI, we are able to pinpoint when a person having migraine, where are those areas in the brain activated, light up. So what we found out from the science perspective, the problem is mainly in the brainstem, where the trigeminal nerve nucleus, and also in the hypothalamus areas. So those are the areas mainly activated. And by the way, in the brainstem, you have trigeminal nerve nucleus, and also you have what? You have actually the vagus nerve right there too. Vagus nerve, vagus reaction. When you have vagus nerve reaction, your heartbeat go very low, you start feel fainting, right? But vagus nerve is the parasympathetic nerve to keep you rest, improve your digestion, so your stomach start moving better, more, and also your gut gonna move more to digest better. That's the reason when you're having migraine and the signal also interfere your vagus nerve function. That's the reason you start having nausea, vomiting, and you may have diarrhea too. Well, what about going upward? The signal from the trigeminal nerve nucleus you project into your hypothalamus areas. Into the hypothalamus area, that's associated including aqueduct areas and the circadian areas. Aqueduct areas is mainly associated with pain. Circadian areas mainly associated with your sleep cycle. Remember, the circadian area in the pineal body secrete melatonin, that area. So you can have sleep problem, then you have all those central nervous system symptoms. It's terrible. Migraine is different from tension headache. Tension headache is more tensing around your scalp, your blood vessel problems, all those areas, inflammation. But migraine is not just your scalp area. It's also your meningeal blood vessel over there, and also inside the brain. That's the reason you have all the flashlight and much more symptoms than just a simple tension headache. You got it? So you have to understand the anatomy of trigeminal nerve and the migraine, all the relationship. If you see this guy and you see that one, so your migraine could be triggered by your cervical problem, or triggered by TMJ. Trigeminal nerve, you understand that many travel to your ophthalmic, that's your eye branch, maxillary branch, and mandibular branch, the 3 branches. As long as you don't have those shooting sensation over here, that's not trigeminal neuralgia. I'll tell you, that's the worst pain. I don't want to treat trigeminal neuralgia. It's very hard to treat. Migraine are curable, period. It's very important to understand that. So when you go inside, that's the brainstem, and go inside hypothalamus. So we have to understand the anatomy of the brain, the areas. Now, how we can cure migraine after identify the cause of the problems, and then you really need to understand what's the relationship, what is causing the neurotransmitter trouble is 5-HT and dopamine. 5-HT and dopamine. 5-HT means 5-hydroxytryptamine. Now, your friend are taking Imitrex is a sumatriptan. So that's the group, the agonist for the 5-HT. That's the reason we're very well. But pay attention. The 5-HT, the serotonin, it's also named serotonin. 90% of them produced in your gut. Let me make it very clear. 90% of them produced in your gut. Yes, you have 500 million neurons in your gut. You have 2 billion neurons in your brain. But 90% serotonin mainly produced in your gut. That was discovered about 10 years ago. And then dopamine, 50% produced in your gut. Now you understand that the reason we are able to cure the migraine is mainly, number 1, you really need to work on the gut. Number 2, work on the hormones. Number 3, clear inflammation, all the different areas. So you have to address those causes of the problems. So let's talk about the cause of the migraine. Number 1 is the weather change. Today is rainy. The barometer change can cause migraine. Number 2, environmental-wise, like somebody cooking barbecue or perfumes or smoke, that can cause issues. Essential oil, some of the people are helped by essential oil, but some people actually can trigger by the essential oil. The third one is food and drink, alcohol, and MSG is a very common cause, MSG. Yes? The last one is stress. So you have to have a diary. Write it down. What caused your migraine problems? And then when you're having migraine, it's the most important thing you got to rest. Relax, drink water, and breathe. You really need to breathe and relax and rest. That can help you. The best medication you can take is Excedrin migraine or some other painkillers. It will help helpful. The Imitrex is one of the number 1, immediately can help abort the migraine. So Imitrex is sumatriptan, that's the 5-HT agonist. That's the very important medication. Or if you don't have the medication, what do you do? I'm going to teach you 5 major acupuncture points going to help you. Number 1, right on temple, your taiyang. That's the taiyang right here. You're going to rub it forward 36 times, backward 36 times. Really heavy on that. Got it? Then the next one you're going to be working on is your GB8. The GB8 is a kneading valley. Kneading valley, that's to help really loosen up the circulation for the liver and gallbladder channel. Remember, your liver and gallbladder channel travel on the side of your body. Liver is your chemical factory. It produces a lot of the neurotransmitters. So it's very important to work on this one. Got it? Got it. Also, there's another one, a little different to talk about, is this one, GB20. The number 20 of gallbladder points is 风池 wind pound. So really over here. Rub on that about 36 times will be very helpful. Okay. Next one, the mountain valley, large intestine 4. It's right here. Rub on it 36 times. You can go other side. Most of our patients are able to stop the migraine. 5th one will be right here. 5th one is on your leg. So you pull your pants up. You can see your the kneecap right here. Use your forefinger, measure down right here. That will be these areas. Got it? Okay, so that's stomach 36. It's one of the best points for boosting immune system, treat acid reflux, digest issues, a person having radiation. This is one of the best points you can use. So those are the 5 points you can use. Number 1, the temple. You can use this one. I'll use Yang Bai. This one is good. And this is GB8, GB20, large intestine 4, stomach 36. Now it's important to understand the type of migraine you have. Usually we divide in the heat type or cold type. If a heat type, you need to use ice. Put ice inside and you rub over here and the back. That will be very, very helpful. Besides pressing on those points, or if you actually have nausea, vomiting, and you have just check out your tongue. If your tongue looks very pale and very thick white coating, that's cold type. So that one, you can use what? You can have some ginger tea immediately, and then heat the stone. You can massage on different areas, or you can boil a hard-boiled egg and then rub on those acupuncture points. It works very, very good. So that's for the acute pain. And for the acute pain, acupuncture works very, very good. If you see the book right here, that's these 2 books, Current Medical Diagnosis and Treatment, Harrison's Principle of Internal Medicine. Those are the Bible for conventional medicine. So inside there's a chapter talk about how acupuncture can help reduce a migraine or prevent a migraine. It's published in 2009. There's an article reviewed 22 reviews. They found acupuncture is more effective than medication for treating migraine and also prevent migraines. Now, next topic, finally, I will talk about how to prevent migraine. That's the very important part. When you have migraine, it's debilitating. Yeah, I understand that. But next things you really need to work on is how to prevent migraine. To prevent migraines, the number 1 thing is lifestyle change. I already told you, you got to have enough sleep. Remember, when you have migraine, the main active areas in your brainstem and your hypothalamus area are also circadian areas. So that's the area for your sleep, regulate your sleep quality. So if you have good sleep, long enough sleep, that will help you tremendously. That's the first thing. And you do exercise. When you do exercise, it helps optimize the environment. You sweat, you detoxify your body. Okay. Number 2, you really need to work on your diet, your gut. So what do you do? So we're going to do a test for this patient to find out what food intolerance he had, and also we'll find nutrition deficiency. That's the first 2 things we need to correct this patient. The next thing we're going to do is that we're going to give the patient a testing kit. They take it home. We'll collect the stool sample in 2 different days. We want to understand the bacteria army. There are more than a trillion of bacteria in your gut. The beneficial one and the non-beneficial one. So they have to balance out. They produce so many enzymes and also support the immune system. So it's very critical for your serotonin production and dopamine production in your body. Got it? So you have to test that. And number 3 is the hormones. Many of you experience the pain before menstruation, after menstruation. That's associated with your hormones. So we have to correct the hormones. So one thing we do is we're going to let the patient take it home. This kit home. So there are 4 vials. You're going to collect saliva in the morning when you wake up, before lunch, before dinner, before going to bed. So we can track down the whole day's your hormone change. And plus we will also check it out, estrogen, testosterone at different times levels. So understand the hormone, correct the hormone is the critical. Number 4 is to detox your body, get rid of the inflammation. If you read the Harvard Health Report, the most recent issue in May, one thing is that Harvard doctors or professors have found one of the major causes of a lot of disease, including diabetes, migraines, high cholesterol, hypertension, are caused by what? Inflammation. So we need to identify where are those inflammations. The best way to treat inflammation, you need to clean your digest system and your diet. Period. Second, to exercise, sweat, that's good. Number 3, the best way is to use acupuncture, cupping acupuncture. You can see on the back a lot of points you see here. as for respiratory for the lung, as for the heart, liver, pancreas, spleen, stomach, ovary, testes. Those points are found out 3,000 years ago. 3,000 years ago, Chinese already found those points. And now, 2,700 years later, in Europe, conventional medicine doctor, when they did anatomy, they found, that's the nerve going to your lung, your heart, liver, pancreas, spleen, ovary, testes. So it matched perfectly with 3,000 years, the Chinese wisdom. So that's the number 4. Number 5 is distress. You got to do your exercise, you got to do meditation, and stay away from the stress. So as long as we correct your gut, clear information, most of you can prevent migraine very successfully. Conclusion for today, our goal is to reverse migraine, stop migraine, and cure migraine. Number 1, you have to work with a physician, get an accurate diagnosis. Some of the migraine are caused by tumor, trigeminal neuralgia, that may not be curable. I'm sorry. But most of the others, you can cure them working with your acupuncturist, your healthcare provider, your physicians, and clear information, correct your gut, it will be much, much better. So we'll put this video on YouTube. Don't forget to subscribe. We're going to talk more about how to reverse diabetes, acid reflux, colitis, diverticulitis. We just had 2 diverticulitis patients coming. We see very good results. Anyway, the key thing is combine with Eastern medicine, conventional medicine together, find the cause problem. Have a consistent system to address that. Thank you very much. Any questions? Check our website, wemedhealth.com. WEMED health.com. wemedhealth.com. Have a great day.